When I was younger, I trained at Landock Hospital to be a nurse, but I left to have children. I went back there for 13 years or so as an auxiliary, working nights, because that way you're there for the kids in the day. I've done 20 odd years, I've worked with different charities, but all around mental health. I've been a trustee and vice chair and chair of a couple. And I absolutely loved it. And then about 5-6 years ago, I mean, I was walking with a stick by then anyway, but about 5-6 years ago, suddenly everything just crashed and I couldn't, partly my back, I couldn't stand up.
I've got MS. I was diagnosed about 20 years ago, and it's a secondary progressive type of MS, which means I was reasonably fit when I was initially diagnosed. But of course, as time progresses, the illness gets slowly worse. And about 2 years ago, I got a bad fall, and then they discovered I had septicemia. With those 2 years, I had to start using a wheelchair full time because my legs pretty well stopped working altogether.
I was born on the 20th of November 1923. I came in this house when I got married in 1955 with my wife Jean. My wife has been dead for 12 years. 12 years.
The Social Services and Wellbeing Act encourages local authorities to work much more closely with individuals in how the care is delivered in a way that matters to them, rather than what is being prescribed perhaps by a care plan.
Previously, when care package was set up, we would have set times and set days when particular care tasks would be done. And every time there would be a change, it was expected the agency would have to contact us, and we would have to agree it and change all the care plan and reflect what the change was. So if somebody did shopping on a Tuesday and wanted to move it to a Wednesday, they would have to ring and the process would start.
Historically, social services give us these care plans. We want to move more and more towards the care agency being told that an individual requires a care package. We know that within that care package they do need to get up, they do need to have lunch, they do need to have tea, and they need to have their evening call. That is tasks. Within those tasks, that person may not require that full. They may not require an hour for getting up in the morning. They may not require an hour to go to bed in the evening. And those hours could be better allocated to that person with further discussion and input from them.
The Your Choice project gives people the opportunity to direct how the care is delivered to them. So this means that the individual at the centre of the care plan has an opportunity, responsibility to direct their own care, to meet their own aspirations and goals that they've set as part of their assessment and care planning process.
A couple of months ago I went on to what they're calling Your Choice, and it does give me a lot more control. I seem to go in phases, say for hospital appointments, and I can go to 2 or 3 a week for a couple of months. And whereas before I just have to cancel all the meal breaks that it covered, well now I can bank them so they're allocated to me in a separate area and I can take them back and use them for whatever I want, which is a huge difference from the actual package of care. Before Your Choice was introduced to me, if I didn't use that time, which could have been I had a hospital appointment or whatever, those hours were lost.
The Your Choice project is an innovative way of working. It's a refreshing way of working. It's challenging, but it is so fulfilling both for the care workers and for the individuals themselves.
I have 4 carers who comes out every day, and I can say If there was any medals to give out, I'd give them to those 4.
Following discussions with Fred, we discovered that he had a perfectly good working shower upstairs. He was currently, with his health needs, living downstairs. We organised for risk assessments to be done on his shower. We organised for risk assessments to be done on him going upstairs. And Fred was exceedingly keen, with a named care worker, to have a shower. We scheduled the shower to be carried out on a Tuesday so that Fred was able to be perfectly groomed, ready to go to his Veterans Club.
Like today, every Tuesday at 9 o'clock, Rachel comes in and she takes me upstairs, and I got a good routine with her. I have a shower, and then I come down, sit down here, and I have a nice 5 minutes quiet, and in comes Joan. Straight away we have a chat and we get ready, and she said, "Are you fit?" Off we go down to Morrison shopping. Come back, as I said, put the shopping away and find a pub for dinner. And after we come back, I put my pyjamas on and my dressing gown, and I sit in a chair, and within 2 or 3 minutes, I'm gone.
I've seen lots of changes, and this first one now with Your Choice is incredible. It actually brings caring alive, not just for myself, but also for the service users that I go to, because they've now got the freedom to choose what they want, not what is allocated to them.
Well, the project helps me live more as an individual. Otherwise, I'm constricted in what I can and can't do. Well, I can get out and, say, use banked hours. If I've got hours built up, I can perhaps go and to a rugby game, because I used to play rugby many years ago for Penarth, and it is nice to be able to go down and watch them play on occasion.
The care workers have told us that working with people in a much more collaborative way is much more enjoyable, much more rewarding, and they feel that they're able to actually do a better job.
This is the way that all social workers that I've met wish to work. We miss having that relationship with the agency, and also we miss the person feeling they have that control over their care.
Since I'm getting the extra time with a carer that is, I don't like the word dictating, but in a sense that's what I'm doing. I'm saying this is what I want, this is what will make a difference to my life and my existence. I do get a lot of support now, and this Your Choice has been really amazing for that.
From my point of view of managing this outcome-focused care, it is something that I am passionate about, that I've really, really enjoyed doing. I've really, really enjoyed getting to know the individuals better and achieving outcomes that they maybe have wished they could have done or had not thought possible for them to do. And it just forms a close bond with the individuals that we care for.
The Your Choice project certainly gives me increased flexibility, and I think that's the most important thing, because if something is too rigid, it prevents you doing what you want to do, and I want to be able to do certain things, and increased flexibility gives me that option.
I think it's a brilliant system, absolutely amazing. I think it would be a total nightmare to administer it. I'm really glad I'm not on that end of the service. But from my perspective, I think it's really, really good, and it does make a difference to the way I feel.
We've been really pleased with the benefits that we've seen with this project, benefits to the well-being and satisfaction of people using the services, the improved relationships between the social workers and the care agency, that we see this as the way that we need to deliver care services into the future.
This Wellbeing Act, for myself, I find is fabulous. It gives so much more choice and freedom to our service users, and you can see the difference that it makes to them and to myself as a carer, because I feel now that I am giving the service user exactly what they want, not what somebody's told them they must have. It's what they want. It's their choice. It's their well-being. It's their life. And they are living it now. And this is what we want.